TCM podcast, all about Chinese medicine. Welcome to a new episode at Traditional Chinese Medicine TCM podcast. Today we're going to talk about the anxiety and depression disorders in traditional Chinese medicine. So what is the traditional Chinese medicine approach toward these syndromes? I'm not going to call this even the diseases, but rather syndromes of something other youthful, unbalanced. So in general, anxiety disorder, which is GAD, accounts for about 8% of primary care visits in the United States and has a lifetime prevalence of about 18%. At present, 13% of the elderly population and 10% of younger adults are being treated with antidepressant medications. Lifetime prevalence for major depressive disorders is about 16%. Other common conditions include post-traumatic stress disorder with a lifetime prevalence of 6%, panic disorder with a lifetime prevalence of 4%, bipolar disorder with a lifetime prevalence of about 4% as well, and obsessive compulsive disorder with a prevalence of about 1.6%. TCM represents complete medical practice, which originated from ancient China through 1,000 years of clinical experiences. TCM has primarily independence as foundation medical healthcare system in China, and it is practiced along Southeast Asian countries and integrative medical approaches. Also, it provides first-choice medical therapies with the traditional Chinese medicine, complemented with acupuncture, and with a wide range of clinically approved therapies and approaches for treating psychiatric disorders. TCM searches for holism between all living things in nature. Speaking of humans, TCM considers that body, mind, and spirit are interactive and independent. Everything is affected by each other, and in particular, the spirit substitutes the existence of body and mind. It is rather exceptional perception to view psychiatric or emotional disorders through these lenses of holism rather than using a more reductionist approach of modern medical systems. By TCM point of view, spirit is connected with God, the universe, or with nature, if you wish. Having such connectivity, the spirit is the source of wisdom and ultimately health. According to modern TCM theory, the human spirit is an energetic opening of the autonomic nervous system. It can be influenced negatively by illness, but alternatively, maturation and cultivation of spirit can lead to healing. If any of the six senses got negatively affected, which I mean for the sixth is intuition, spiritual cultivation may be achieved by a number of activities such as arts, meditation, yoga, etc. It means that any kind of spiritual illnesses and physical manifestations alternatively can be treated only by cultivating spirit. Treating a person with emotional disorders using TCM, firstly we have to relieve physical suffering. Secondly, through the process of cultivation, spiritual energy is nourished and purified, and finally, negative energy is transformed into positive energy, thus promoting an energetic balance. Result of our action is harmonization of mind, body and spirit. In addition to Chinese herbal medicine, we use acupuncture, qigong, yoga, tai chi chuan, tuina as TCM medical disciplines for addressing the spiritual components of emotional disorders. Main function of TCM in the global arena is for the betterment of mankind. According to TCM theory, the human body consists of 5 Zang and 6 Fu organs, which are characterized by the 5 elements. In Chinese, 五行, namely metal, wood, water, fire, and earth. In the realm of the five elements theory, the Zang-Fu organs are functionally interlinked with each other by generating and restricting mode of action, resulting in an optimally functioning body by maintaining a holistic Yin-Yang balance. Disease will develop when this balance is distorted, as in the cases of over-restricting and counter-restricting. Furthermore, the Zang-Fu, which means all visceral organs, interplay, responds to environmental conditions, and these conditions refers to as external evils, and it can distort the yin-yang balance, and of course it will result in disease. TCM theoretical and clinical practice adopts a holistic approach in making diagnostics of diseases with a categorization of symptoms into various patterns of internal organs. In TCM perspective, various emotions, in Chinese which is qingzhi, do influence an individual's physiological functions. In TCM theory, there are 7 qing emotions, which 5 are collectively called zhi. Those are namely joy, anger, grief, anxiety, and fright, and they are characterized by 5 elements, namely fire, wood, metal, earth, and water. As some organs are linked to these 5 elements, the overexpression of each zhi can affect the function of each respective internal organ. In light of the 5 element theory, all emotions are related by generating, restricting, over-restricting, and reverse restricting one another. Therefore, balancing the expression of the 5 emotions is thought to be crucial in maintaining physiological and physical health. As TCM and Western medicine represent 2 distinct medical approaches with different origins, both diagnostic strategies and interpretation of symptoms are quite different from those of each another. Stress can be defined as a short-term psychological pressure when only limited resources are available to finish a task, whereas anxiety can be defined as long-term worry about something uncertain in the future. Yet, a prolonged state of stress can also lead to anxiety. In TCM, psychiatric and psychological disorders often relate to energetic disharmonies involving the so-called 5 spirits, or in Chinese, Wu Shen. Emotions are described by these spirits, which are in Chinese the Hun, Po, Zhi, Yi, and the Shen. The first one, so-called the Hun, is stored by the liver, and it's called non-corporeal or non-materialistic because it is not dependent upon physical being for existence, and it continues living after death. This spirit is responsible for love to kindness, awareness of suffering, empathy, compassion, and tolerance, and serves as a reservoir for ideas that bring meaning into life. It is said the liver stores blood, and the blood houses the ethereal soul. These harmonies that affect the Hun may lead to anger, frustration, resentment, unkindness, and signs such as sleepwalking and sleep-talking. The Po is corporal or animal soul. It is non-physical aspect of human being. It exists only during physical life. It is associated with lungs, and the Po animates the being. It is responsible for the sensation and for emotional and physical responses to circumstances. It promotes justice and fairness. These harmonies of the Po may lead to complicated grief, sadness, a blunted affect, a tendency to overreact, or of just immoral behavior. The corporal soul is believed to be closely related to essence, which in the traditional view is the foundation of human life. The Zhi is the will or determination of mind and emotions. Zhi is the spiritual aspect that resides in the kidneys. The Zhi means memory, wherein individuals finds his orientation in time, and it provides the motivation for self-determination. The Zhi leads one down the path to an unknowable fate. Disharmony may cause illogical fears, or the opposite, reckless behaviors. The Yi is the term which closely describes the intellect. It is the platform for conscious reasoning. The Yi enables creative vision and appropriate courses of action. The Yi is associated with the spleen, and these harmonies may lead to worries and overthinking. Shen, or spirit mind, allows the inner being to connect with the outer world, and the outer world to connect with the inner being. It is also the mind, where thoughts and feelings are experienced. The Chinese concept of spirit is what normally makes us conscious and alert during the day, what becomes inactive during sleeping. It is stored by the heart and has to return to the heart during sleeping. It might be present in conditions of heart palpitations, susceptibility to fright, heart fixation, and insomnia. TCM treatments are intended to restore relative balance. Balance is accomplished by influencing the vital energy known by ancient Chinese as qi. By Chinese natural philosophy and TCM basic theory, qi flows through channels in the body and in the spaces between muscles and the skin. Qi has many functions including warming, moistening and nourishing, promoting normal function of the organs, providing energy for different processes, regulating the body, protecting the body, and ensuring that organs remain in the proper position. A very important role of Qi is maintaining balance. It is a regulatory homeostatic mechanism by which the body can heal itself and establish a state of wellness. If Qi encounters a Yin-Yang imbalance, then Qi corrects the situation by transforming one to the other, thus restoring balance and harmony. If, however, a blockage exists that impedes the flow of Qi, a factor is present that is interfering with the Qi, or if there is a deficiency of Qi, this healing transformation does not take place. There are various experiences, clinically proved TCM techniques for opening blocked channels, for expelling pathogenic factors that are interfering with normal processes, and to boost Qi in cases of deficiency. In TCM diagnostics, various patterns of disharmony may correspond to the same Western diagnosis, and vice versa. In modern medicine, diagnostics may apply to the same TCM pattern of disharmony. Yes, all of these might be pretty rare, but the treatment principle in modern medicine is based upon diagnosis, whereas the treatment principle in TCM is based upon recognition of the pattern of disharmonies. Best option is to simultaneously combine the best of both modalities in order to provide the most effective treatment. Studies have shown that general anxiety disorder, GAD, can be characterized by an asymmetrical expression of the sympathetic nervous system and hypothalamic pituitary adrenal axis. Based on this observation, it can be deduced that the influence of anxiety is likely mediated by both nerves and endocrine factors. TCM diagnostics of anxiety and depression disorders include 6 patterns of pathological disharmonies. Ultimately, TCM treatment options related to anxiety itself represents following pathological syndromes and its TCM treatment formula. For the heart Qi deficiency, the Chinese herbal formula is Miao Xiang San, marvelously fragrant powder in English. For the heart and kidney yin deficiency, herbal formula is Tian Wang Bu Xing Dan. For the pattern of heart Qi and yin deficiency, Zhi Gan Cao Tang. which is in English baked liquorized combination, the pattern of heart, blood, and spleen qi deficiency, very famous herbal remedy, gui pi tang, which is in English ginseng and longan combination, pattern of heart and gallbladder yin, actually qi deficiency. It is a herbal remedy which is called ding zhi wan, in English modify, settle the emotion pills, and the pattern of sudden shock. Herbal remedy or herbal combination is gui zhi jia long gu mu li tang, which in English is cinnamon and dragon bone combination. For the depression itself is, on the other hand, related to anxiety. Depression is manifested mainly as emotional ability, or physically it can be manifested as chest fullness or tightness, subcostal distension or pain, and globus hystericus. The passions are the primary causative factors in depression, so it is all related to emotions. Liver's ability to disperse and transport and heart's ability to govern the mind become compromised. For example, a patient with a chronically high level of liver activity is more prone to illness or being emotionally frustrated. Liver qi may stagnate and may cause chest and subcostal distension and pain. When stagnant liver qi, it can transform into fire, which, if is persistent, may lead to obstruction of meridians and stasis of blood. If stagnant qi transforms into phlegm, the blocked liver injures the spleen, or there is excessive brooding and anxiety, then the spleen loses its ability to transport, so that dampness accumulates and transforms into phlegm. This results in an illness of phlegm accumulation and qi stagnation. Intermixture of stagnation of qi and phlegm blockage the throat and gives rise to the globus hystericus. If heart and spleen qi become chronically stagnant, there may be anorexia, so that the sources for the generation of qi and blood become reduced. This may lead to emotional ability with proneness to sadness, worriness, and weeping. Or it can lead to an illness of deficiency of both qi and blood in the heart and the spleen. In depression, the main visceral organs affected are the liver and the heart, but other organs may become involved. In its initial stages, depression is an illness of strength caused by pathogenic factors. Its pathology is principally qi stagnation, but may involve blood stasis, rise of endogenous fire, rise of phlegm, or better say stagnation of phlegm, or food retention. If it persists, it evolves from an illness of strength to one of deficiency. Clinically, strength and deficiency may become intermixed, and it is common for the illness after the initial stages to become one of deficiencies of qi, blood, yin or yang. Clinical symptoms of depressions are those of qi stagnation, such as unstable emotions and chest and subcostal distension and pain. If other stagnation develops, there may be other corresponding symptoms, for example, blood stasis as well, and therefore, for example, patients may show distension or stabbing pain in the chest and trunk with fixed location. If there is excess of fire, there may be impatience, irritability, chest tightness, subcostal pain, and related to Chinese diagnostics, a dry mouth with bitter taste, constipation, a red tongue with yellow coating, and a taut and rapid pulse. If there is food retention, there may be gastric distension, foul eructation, and anorexia. If there is accumulation of dampness, there may be heaviness in the body, abdominal distension, a greasy mouth, loose feces, or diarrhea. If there is a phlegm, there may be abdominal distension, a sensation of a foreign object in the throat, and a greasy tongue coating. Most patients have a history of melancholy, anxiety, sorrow, fear. The development of depression is principally due to blockage of liver qi, which leads the spleen losing its transportation and transformation functions, and the heart losing its nourishment. Though all three organs are generally involved, in deciding treatment, it is important to ascertain whether there is a stasis of blood, fire excess, accumulation of dampness, or simply stagnation. Stasis of blood, stagnation of qi, fire are mostly related to the liver. Food retention, dampness, and phlegma accumulation are mostly related to the spleen. Deficiency, on the other hand, is mostly intimately related to the heart. In diagnosis, a critical differentiation is between strength and deficiency. However, strength and deficiency can transform into each other. In a patient with prolonged depression, there may also be mixed symptoms of deficiencies and strength as well. Herbal treatments for different types of depression are based basically to regulate qi and to open orifices. For illness of the strength variety, it is important to determine where there is a blood stasis, rise of fire, phlegma, or accumulation of dampness, or retention of food, as we mentioned previously. For illnesses of the deficiency, we should determine, actually it is important to strengthen the visceral organs and to, of course, to strengthen qi, blood, yin and yang. In general, depression has a relatively prolonged course of treatment, and if we treat depression, which is based on strength, we should focus on regulating qi without depleting it. We should mobilize blood without inducing bleeding, and we should cool heat without injuring the stomach, or dissipating phlegm without damaging genuine qi. When we treat depression within the deficiency, we should focus on strengthening the heart and take the spleen without excessive drying, actually, or we should nourish the liver and the kidney without basically dietary excesses. For the patterns of the liver qi, which is the most common, in fact, main symptoms are mental depression, emotional lability, and then physically speaking, chest distension and tightness, subcostal pressure and pain without a fixed position, epigastric bloating and eructation, anorexia, and irregular defecation. The tongue coating is thin and greasy, and the pulse taut. Therapeutic principles is to regulate the liver qi to relieve depression, and the treatment herbal remedy is used, a common one at least, very famous, is Chai Hu Shu Gan Tang, which would be in English something like Buplarum liver releasing decoction. If subcostal distension or pain is particularly severe, we should add Yujin, which is curcuma, Qingpi, which is citrus tangerine, which means unripe pill, and Fosho, citrus medica, to unblock the liver and regulate the qi. For the patterns of stagnation of qi, which transforms eventually into fire, we can find the main symptoms are impatience and irritability, chest and subcostal fullness, and dry, bitter mouth, or headaches, red eyes, and tinnitus, also accompanied with, but not dominantly, with epigastric distresses, acid problems, and constipation. The tongue is red, and its coating is yellow. The pulse is taut and rapid. We should follow the principles to unblock the liver qi in order to relieve depression, and of course to clear liver heat and purge fire. Herbal formula, very famous one, is Danzhi Xiaoyao San or Danzhi Xiaoyao Wan, which is carefree powder with ponia and gardenia. If fire is severe, with bitter taste in the mouth and constipation, we should add Langdang Cao, Yantiana, and Da Huan. which is raum palmatum, to purge heat and unblock the viscera. If liver fire invades the stomach, and if it causes subcostal pain, bitter taste or epigastric distress, eructation or vomiting, we should add Huan Lian, which is Coptis, and Wu Zhu Yu, which is Evodia, to clear the liver in order to purge fire and suppress the abnormal rising and, of course, to stop vomiting. If liver fire flames upward and if causes headaches and red eyes, we should add Juhua, which is chrysanthemum, Goutang, and Ancaria, and Chili, Tribulus terrestris, to cool, heat, and settle the liver. For the pattern of stagnation of phlegm and qi, the main symptoms are mental depression, chest tightness, subcostal extension pain, and globus hystericus. But we may say this is the same as the previous patterns in this sense, but what really difference is the tongue coating is white and greasy, and the pulse is taut and slippery. So that is which basically determines us to understand that is basically the stagnation. The principles of therapies is to mobilize qi and to relieve obstruction, dissipate phlegm, and dissolved accumulations. Herbal formula is Bengxia Shilbanxia Ho Po Tang, and if fluids are damaged, the mouth dry and the tongue red, we should remove Ho Po and Zisu stalk and add Bei Shan Shan, which is Glenia, and Mai Mendong, which is Opiopogon. If the illness is prolonged and has entered the collateral meridians, there may be such symptoms as blood stasis, stabbing chest, and subcostal pain, and then tongue is more cyanotic or speckled with petechias or ecchymosis and an impaired pulse. When we're talking about the patterns of deficiency basically of heart and spleen, we can face the patients with feelings of suspiciousness, feeling of dizziness, lassitude, palpitation of the heart, insomnia, forgetfulness, anorexia, and lusterless complexion. So it's all the symptoms basically of deficiencies. The tongue is pale with a white and thin coating. The pulse is thread-like. Basic principle is to strengthen the spleen, nourish the heart, augment qi, and generate blood. Treatment is Gui Pi 1 or Gui Pi Tang herbal remedy. If there is a chest tightness with subdued spirit, we should add Eugene, curcuma, and 4 show slices Citrus medicum, Sacrodactylus, to regulate qi and relieve stagnation. When deficiency occur, especially the pattern deficiencies of liver yin, main symptoms are dizziness, tinnitus, dry eyes, photophobias, blurred vision, or may expand to the headaches, facial flushing, red eyes, with a feeling of impatience and numbness of limbs and muscle twitching. The tongue is dry and red, and the pulse taut and tread-like or may be rapid. Basic principle is to nourish and replenish yin essence and invigorate the liver and the kidneys. Herbal formula which is used for the basic deficiencies and special deficiencies to liver yin is Qi Ju Di Huanwan. For the pattern of mental derangement, and we can face basically the patient with totally absent mindedness, restless mind, emotional ability, suspiciousness, and fearfulness, or maybe even frequent yawning and stretching, chorea-like movements, and outbursts of uncontrollable cursing or swearing. The tongue is pale and the pulse is taut. Basic principle is to nourish the heart and tranquilize the mind by means of sweating and using moistening herbs to ameliorate the urgent So main herbal formula is the ganmai da zao dang, which is liquorized wheat date decoction. Okay. As we mentioned, the herbal formulas for both anxiety and depression, I would like to also to mention the acupuncture treatment, at least successful acupuncture treatment. I'd refer acupuncture treatment which are used in Chinese medicine hospitals. I refer especially to the Tianjin University of Chinese Medicine hospitals. Very common is at least very standardized treatment for the stagnation liver qi would be to select Qimen, which is liver channel 14, Yanglin Chuan gallbladder 34, Zhongwen, which is CV12, Zhusan Li stomach 36, and Ganshu bladder 18. All of these points, acupuncture points, we should apply a reducing method. For the pattern of fragment qi stagnation, we should select Zhongwan, which is CV12, Fanlong, stomach channel 40, Tiantu, CV22, and Taichung, liver 3. We should use filiform needles and again the reducing method. When the failure of heart nourishment occur, we should select Nig1 as a first choice, which is pericardium 6, Shanmen heart 7, Shigou GV26 governing 26, and Xinshu bladder 15. And in this case, we should apply the reinforcing method. When the mental derangement occurs, again, the first choice is Nig1, pericardium 6, Shanmen heart 7, Huxi small intestine 3, and Sanjiao spleen 6. We again use reinforcing method. When this mental derangement is accompanied by tics of the upper limbs, we should add Chucher, large intestine 11, and Hegu, large intestine 4. And in the case when there are tics of the lower limbs, we should add Yaling Chuan, gallbladder 34, and Kunlun, bladder 60. And if the patient has rapid breathing and abnormal qi movement, we should add Tanzhong, CV17. So, in generally, as mentioned previous, the course of treatments for anxiety and depression is quite long. Something which I haven't covered this time, it's lifetime and lifestyle changes and of course and changes of the food, which is certainly very important. Besides that, it's important to socialize. It is important to do exercises. I'm talking about particularly qigong exercises, Dao Yin exercises. It is quite good to do also exercises with the hyperventilation, such as, for example, talking about modern time, the quite famous Wim Hof exercises, which again, it does exist in yoga, such as hyperventilation exercises. And all of these have aim basically to relieve symptoms from the physical, mental, and spiritual point of view. To not have anxiety and depression, to be active, to do exercises which are effective against such as syndromes, and to be happy. And hear you next time with love and light. TCM Podcast, all about Chinese medicine.